The management of primary biliary cholangitis across UK hospitals. Does care differ? PBC is an autoimmune liver disease typically diagnosed in females over the age of 50. First-line therapy is ursodeoxycholic acid and treatment is lifelong. Now, there are three key features to note of PBC. Firstly, it is progressive. It can lead to cirrhosis and its complications. The symptom burden can have a larger impact on the quality of life of patients, and it's highly variable in terms of presentation and progression. So it's important to identify high-risk individuals early and provide individualized care. Guidelines were published a couple years ago with recommendations on managing the disease. To this day, no formal assessment has been undertaken on national performance. In our study, audits were carried out at 11 NHS trusts between 2017 and 2020 using a tool based on the guidelines. Data was collated from all sites for national analysis, and we assessed 9 different standards in total based on the key management guidance, 5 of which had recommended targets that were published in the guidelines. In our analysis, we wanted to answer 2 key questions. 1, are targets being met? And 2, is there variation in performance across the UK? To briefly summarise our results, we obtained data from almost 800 patients across England, Wales and Scotland. We found a majority of failures in meeting targets across all hospitals. For 3 of the standards, none of the hospitals met the corresponding target. We also observed significant variation between the hospitals for 5 of the key targets. I will display the graphs for these now. This is the first nationwide audit of its kind, which will set the foundations for future PBC quality improvement. There are other strengths to this study. It has a large sample size spread across the nation, making it representative of the PBC population treated by the NHS. Data was obtained from medical records, and thus it should represent real clinical practice. These findings aren't surprising, but now we have the evidence of this in the UK, and this evidence we hope will be used to bring about awareness of the guidance and awareness of the need to improve performance. And we hope this will facilitate positive change. Of course, there are limitations. Firstly, there is variability in the quality of the collected data, and the study depended on the assumption that medical records are accurate. The audit only identified the existence of the missed targets. However, it didn't analyse the reasons behind these, so no specific solutions can be formulated. Most of the data was collected a couple of years ago, so the findings may not reflect current practice in 2020. And lastly, we need to be cautious about extrapolating our findings. We ideally need a full assessment of all UK hospitals managing PBC patients. So in terms of future direction, we aim to implement a PBC review tool into clinical practice. This will be a form based on the key guidelines to help clinicians check they're managing patients appropriately. This audit will also be used to create an improved, more thorough audit for a formalised widespread audit on all UK trusts to be completed by the end of 2021. Improvements include analysis of reasons for non-adherence, such as poor tolerance of medication, and also we could potentially establish a PBC registry for the ease of future quality improvement projects. Thank you for listening.